All right, so yesterday we saw those images of the mayor of Gqeberha standing at traffic lights, just handing out flyers, saying to citizens of the Nelson Mandela Bay Metro to please remember to save water. We know that the city and surrounding areas really are having an uphill battle. The National Water and Sanitation Department officials are there. They've been helping the city trying to reorganize the water supply, but it is a very, very difficult situation. Let's get an update now on more efforts to help Nelson Mandela Bay Municipality. I'm joined by Dr Imtiaz Sooliman, CEO and founder of the humanitarian organisation Gift of the Givers. You'll remember, of course, that they have been in the area in the past few weeks drilling boreholes. Thank you so much for joining us, Dr Sooliman. Talk to me about the boreholes. How's it going? How many have you drilled?
Good evening, Sally. It's going very, very well. We've already drilled 11. We finished 10. We will do the 11th one and the 12th one by tomorrow or the next day. In addition to that, we've got, so there's 12 boreholes will be fully functional by the weekend. We've had 3 that we've drilled previously before we came to the city, and those 3 are drilled in schools, which we are now expanding to provide taps to outside the community. 2 of those already have the taps outside for the community. In addition to that, we've opened up, we've spoken to the municipality and whoever's got boreholes that have been closed for some time. The K9 unit called us and we resuscitated a borehole that was closed. We're getting 4,000 litres per hour from that one. And then there's 3 boreholes that belong to the municipality, and we've got an arrangement that if the borehole is in the right side, Gift of the Givers will open it, we'll put in the pumps, we'll put in the piping, we'll put in the taps. So we did one at Galvindale Stadium, the other one at Victoria Park, and the third one at the Donkin Reserve. So that's 4 additional boreholes, plus the 11 we drilled, which will be 12 soon, and the other 3 previously. Right now, we're yielding 3.5 million litres a day from the boreholes that we've drilled, and we expect that figure to rise substantially by early next week. And to augment that, Seribos has been very good to us, providing 500,000 litres of water per day from the desalination plant. So as we stand right now, we're introducing 4 million litres of water per day into the city.
And how is that helping? I'm trying to get an understanding of the scale of the need.
Well, if you take 10 litres per person, you can basically help 400,000 people. You just take a minimum of 10 litres for drinking, for medication, for washing the baby. So it's 400,000 people can benefit. Although, of course, the stats don't look exactly like that. Sure. If the scale of the benefit, or to get the scale, in Bushland, in the Utenhage area, we're using the scopes tankers. They've given us 3 by 35,000 litre tankers, which collect the water from Seribos, and there's 11 extensions in Kwanu Bushland. And that water is going to that area in Utenhage area where every day there's more calls that water is running out. Even before you can put the water in the JoJo tanks, you have to open the taps of the water tanker because people are desperate. So, it's a desperate situation, and it takes time for water to come out of the water tanker, but we can't do anything right now until we organize more JoJo tanks and get more boreholes there. So right now, people will have to take the water from the water tankers, but fortunately, there's 3. So the water tankers are providing a substantial amount of water directly to the person. They come with their packets, they collect it. The big difference we're going to see on Monday and Tuesday when the schools open up, because a lot of our boreholes are in schools, and we've placed them in very critical areas. So in other words, if there's 1,100 children in a school, they will get water in the school toilets will get water, the teaching staff and the management will get water, and when they go home in the afternoon, each one can take water for their families, a 5 litre or a 10 litre, they can take it for their families. And in addition to that, the communities that live around the schools, and we've placed it in areas where there's fairly large communities. And for example, in a school called Malabar Primary School, there's 4 informal settlements around the school, and also there's a built-up community of formal homes. So there'll be a substantial benefit to them. The other benefits are the Livingston Hospital, the largest hospital in Gqeberha. We've got a fairly good yield of 24,000 litres per hour. It will build the reserves of the water tanks. So if the water shuts off, at least the reserves there, and we're putting booster pumps to fill the water tankers quickly. The other hospital, the PE Provincial, is slightly in more trouble. They have less water, and we're busy drilling there right now, and the yields are looking good. We're also giving them increased water capacity, 250,000 litre tank, which will provide, or it's a bladder, that will provide additional storage water for the hospital. So in terms of scale, basically the health services in the 2 major hospitals are going to benefit immensely. And the other two hospitals, the Elizabeth Donkin Psychiatric Hospital, I mean, a psychiatric hospital, you just cannot not be a case where there's no water. And there's a very good yield there, and we've connected to every aspect of the hospital. The pipes have been put in, and the last hospital is Jose Pearson, the TV hospital. So we very carefully selected hospitals, schools, communities to get water to the right places as fast as possible.
It does sound like a really good strategy, incredible work. Did you say 4 million litres a day that you're basically going to be able to provide? That's astonishing. I want to ask you a little bit more about Uitenhage, because we got a very disturbing press release from the crisis committee, I think in the KwaNobuhle area. They say that there are basically 5,000 homes in the Chris Hani, I think it's an informal settlement, which just has no water at all. And for the other part of KwaNobuhle, there's a half-filled water tanker that manages to get around by sheer luck, it seems. Have you noticed, because they're saying that if you're in a middle-class area in Nelson Mandela Bay or Dispatch, you're basically okay in terms of water, but if you're in a really poor area, you're getting neglected. Have you noticed that?
I don't think that's absolutely correct. The water shuts off in any area. It depends on look, we're sending water tankers into the KwaNobuhle area. We're trying to find all boreholes, but the problem is they're not too near the communities. So there's no point opening boreholes that are very long distance away from the communities. That's a problem. Yes, it's true that, a lot of them haven't had water for quite some time, and that's got to do with the water distribution system within the water reticulation system. It's not selectively that they've been left out. This is a historical problem. It's not something recent. But even in town and in areas where it's supposed to be more affluent, the water shuts down because wherever we go, initially we were told there's red zones. And one day we get a call, people say, but in the yellow zones, the water is suddenly gone. So and there's no planned strategy. It just happens. I think the water just runs out and nobody's got any control over that. It's not done deliberately to shut poor people off or to give water to rich people. Even industry, they try to save the industry. But we got calls from industry to say that the water has been cut off from us too. And only those people are successful or benefit who've got their own boreholes. So there is no deliberate intention to cut people off, whether they're rich or poor. It just happens, and that's something nobody can control.
I mean, very quickly, despite massive efforts on your part, and we know that there are other players involved as well, it's still very much touch and go. Have you got a sense of, is day zero a distant reality? Is day zero far away? Or is it still a very real threat?
Well, to me, day zero is already there for some people. It's in some areas, if you haven't had water for 3 days and 5 days and 7 days, you're on day zero, And what each day, more and more communities are calling us. I mean, 14 clinics called us and said, if we don't have water, we have to shut down. That's why the PV Provincial Hospital, Livingston Hospital was worried. People are trying to be proactive. And to save time, we're also rolling out bottled water to institutions like old age homes, homes for the physically and mentally challenged. You can't expect them to come to a truck to collect water. So until we put JoJo tanks in those yards, and we've been donated large amounts of JoJo tanks and working with the municipality, they're setting up 50 sites. And we will equip all those 50 sites with JoJo tanks and help with our water tankers. We're bringing more water tankers, but it's a long road to go. We don't have enough time. And there's too much need as the dams are shutting down. So as fast as we work, you can't work faster than that. Pipes take time, drilling takes time, testing water takes time. But, we're hoping that at some point it will balance off and the city won't be in a too critical position.
And thank you very much for giving us such a comprehensive update and for all the good work that you and your organisation does. We do appreciate it. I'm sure the people of Nelson Mandela Bay appreciate it a great deal as well. Thank you for your time this evening. Dr Imtiaz Sooliman, CEO and founder of the humanitarian organisation Gift of the Givers.